the light in the place if when they have control over that, or living where the light is and then they are still able to do their work. So most time it's often underdiagnosed and often not attention is really not paid to, except when it is now affecting your work or reducing productivity. Most times that's when people come into the clinic to complain about photophobia. But like you said in your intro, photophobia is a symptom and most time may not even be strictly an eye-related problem. Sometimes it can be related to the eye, or it can be a symptom of an underlying condition affecting the brain.
Wow.
Yes. In fact, there was a patient I saw some time ago who had tumor in the brain.
Oh, wow.
Yes, I was always complaining of photophobia. So some of these things can actually occur. So anytime someone actually cannot withstand light, especially bright light, causing discomfort or pain, we often say the person has photophobia. Some of the causes, it can be related to the eye. When it's related to the eye, we call it ocular causes. So when someone comes into the eye clinic, for example, and complaining of photophobia or light sensitivity, we try to rule out the causes. That's why we say we do a diagnosis. So if it's related to the eye, we treat in the eye clinic. If not, we refer, like the case of Amina that I talked about. So for some of the ocular causes, somebody that have what we call a dry eye syndrome can actually experience photophobia. Somebody with an inflammation in the eye, maybe a uveitis, an arthritis, or even sometimes conjunctivitis, any form of inflammation. The person may complain about photophobia. Then abrasion, corneal abrasion or corneal ulcer. Sometimes when there's injury on the cornea, the cornea is a transparent membrane that lines the black of the eye, the iris. So sometimes when there's an injury, you may not know. Mistakenly, you can just use your finger to scratch the eye, and then there is a small cause. Yes, it can induce photophobia. Cataracts too can also make someone start having light sensitivity, where especially when the cataract is just developing and then obstructing the way light rays go through the eye. So the patient or someone actually may complain of photophobia. Neurological causes, like I said, someone had tumor, was always complaining about light sensitivity. Migraine is another reason. Wow, many young women too, they have a lot of complaints about migraine. Migraine, from my experience, it's not so common among men, but many women, especially young, between the age of 18 to maybe 34, 40, thereabout. Yes, they have migraine. And when this comes, light sensitivity could be one of them, meningitis. And when there is a brain injury as well, some form of medications too, especially people who do self-medication. Yes, they are also, exposing their eyes to this symptom of light sensitivity. Then people who take antihistamines, there are some people, any little thing, they just go to the pharmacy to buy. Yes, antihistamines, they are medications taken for allergy. Like people who are always taking Loratadine. I shouldn't have mentioned
the brand.
I hope it's not a brand. Although some people, actually have that brand.
Yes.
So antihistamines, that's the right word to use, so we don't black anybody. Yeah. So antihistamines, so let's be careful. People who are repeatedly on that could be, exposing their eyes to photophobia over time. Antidepressant and also antibiotics, certain antibiotics as well. And then other causes would include albinism, because there's not enough melanin in the eye. People, who are born with albino, who are albinos, may experience photophobia. Then unequal pupil, hole in the pupil, anything that has to do with deformity, either of the pupil or the iris, they could also complain of photophobia. Then also for people, some people who have done surgery, maybe cataract surgery, glaucoma surgery, or any post-surgery, can actually induce some form of light sensitivity, like LASIK, for example. But the common symptoms most people will have is just that discomfort or pain when exposed to light. Then squinting or closing the eyes in bright environment, headaches, which usually they are triggered by the light and also worsened by the light. You could have watery or redness of the eye, nausea or dizziness, which that can occur in severe cases, especially people that would have migraine complications. They can start complaining of nausea or dizziness. And I found out that when patients experience these symptoms, the first thing that comes to their mind is malaria. And then they go and buy anti-malaria. They say for malaria, they say it's malaria and typhoid. Meanwhile, they've not done any test too. Meanwhile, it's not malaria, it's not. So most time people just equate, this feeling of photophobia to malaria and typhoid. And at the end of the day, they are making the conditions worse. So it's not good to self-medicate. If you're having symptoms, go to the right source, be diagnosed such that the right treatment can be given. Because if you keep using the wrong medications, it will get to a point that those medications will no longer work. Your body becomes resistant to them. Let's just look at some of the risk factors. Excessive screen use. We are in the digital world now.
Age, yes.
Everybody's looking at something.
Yes, so. Some people don't even use TV at home anymore.
At all. Do you know that God did not create the human eye for anything that is rectangular like this, emanating light to the eyes? God did not design the human eye.
So what did God design eyes for?
God created our eyes for natural light, not artificial light.
Oh, okay.
Yeah.
But God also gave us the brain, to invent all these digital gadgets.
Oh, sure. God has given us that brain along with the invention and also the side effects. Am I not saying you should not use digital display?
Well,
no. But you have to prepare for the side effects. You must be able to cope. For things that have an advantage, there will be a disadvantage.
Wisdom is profitable to direct.
The myriad of eye problems is actually going to creep up because everybody is now glued to a rectangular object that emanates light, artificial light to the eye too.
How about we start creating a secular object with light?
Whether it's secular or not, so long as it's emanating artificial light to the eye, there's going to be a problem. Actually, if you come to think of it, when we used to read just books, it wasn't this bad.
Sure.
People don't read on the book again
anymore. Yeah.
On pads, on digital display units now. So the more we are glued to it, the more you can.
Some of us still carry pen and paper.
Yeah, I do. I do. Even in worship centers now, most time what you see is.
I find myself studying and still carrying my pen and paper.
So, honestly speaking, it's still better to read from your book than from
the screen.
Digital display units. Well, some people may argue about that, but in terms of health, it's actually better. Apart from maybe the reading to understand or comprehend, there's what we call the eye-hand coordination.
Okay.
When you read or you write,
yes,
the brain helps to coordinate the hand, the eye, and then make sure that it develops properly.
100%, I agree.
So, in a bid to make our world more comfortable for us to live in, we're also inadvertently bringing on some negativities. And that's why I keep saying that you shouldn't just leave your eye to chance. So long as your eyes are exposed to screen, please go and do an eye examination and make sure your eyes are protected. Okay, apart from those risk factors, we could also have photophobia in children. In children, I found out that this actually is neglected.
Okay. How does it occur in children?
Yes, because now too, our children are exposed to tablets as well. They are exposed to digital display units. And there are quite a number of reasons why photophobia will occur in children. Sometimes it can present as maybe avoidance of bright rooms. You find that some children, once they are in school, especially brightly lit school, you give them work. For some reason, they try to renege. They may not be able to explain. They may be experiencing photophobia. And then maybe you take them home, you give them assignments, they do better. But in school, they just withdraw because most times schools are always well lit.
Sure.
So that's why we must be observant as parents, as teachers, as educators, to pinpoint what our problem, the children's problems are, before we start beating them and calling them names that those children do not deserve to be called. Okay? Excessive blinking or tearing. You also find some children, once they are in bright, where there's excessive light, they squint, they blink, and then they are always teary. And then irritability that they themselves may not be able to explain. There are quite a number of reasons why this will happen in children. refractive error, uncorrected refractive error.
Okay.
Like short sight, long sight, astigmatism could actually make this happen in children. Sometimes eye infections like conjunctivitis can actually cause this. Then congenital conditions like maybe when there is a deformity in the iris or in the pupil, or children born with albinism. Some people have what we call ocular albinism.
Okay.
That's the albinism we show only in the eye. The skin will just be normal.
Really?
Yes. Albinism can manifest in two ways. It can manifest on the skin and on the eye. For some people, it will manifest only on the skin and the eye will look a bit okay. While for some, the skin will look normal, the eye will be purely without melanin. Albinism can manifest there. And when that happens, we find out that some children, they try to avoid excessive light. And
I'm trying to think if I have ever seen that.
Oh yeah, there's what we call ocular albinism, just restricted to the eye alone, and both can also co-occur. For the management, we need to do child-friendly eye examinations, treat underlying conditions, and educate parents on avoiding overexposure to screens and bright light. So it's also good that as parents, even now, we should try as much as possible to allow our children look at natural light and nature instead of exposing them to excessive screens. I was in the clinic one day and a couple came in for their eye examination. They came with their child about less than a year. In fact, the baby was actually in a cot. As we were doing the test, the mom was doing the test. The father was with the baby. And the baby started crying. The next thing, the dad brought out his phone, put it on the children PlayStation, gave it to the baby. And the baby started giggling and stopped crying. I said, Daddy, what are you doing? He said, that's the only way she will calm down.
Oh, wow.
Yeah, this baby is less than a year, about maybe 8 months or 9, thereabout. And I had to educate both parents on the danger of what they were doing. So we have to be careful. Sometimes in a bid to acquire comfort, we kind of drag some other negativities along with it. So what's the management for photophobia? We must identify and treat the underlying cause first and foremost. Please, it's not only malaria and typhoid that will give you photophobia. Don't just say, oh, in fact, there was one patient that told me, say, Dr. Imade, I know the way my body is doing me. Anytime I have this symptom, I know that it's malaria and typhoid.
Oh my God.
Please do a test first and see your physician or see your optometrist before you just start self-medicating for malaria and typhoid when those are not actually the problems giving you that light sensitivity. Environmental modifications too. You can modify your environment. In fact, before I came, I was listening to one of the preachers on, I don't want to mention his name. He said in his room he had bright lights, and then they told him he could control it with Alexa. Wow. And after a while, Alexa stopped responding. I'm sure people who saw that post, we know who I'm talking about. So please, let's modify our environment. Let's know the right kind of light to use in our rooms. And of course, if you're always outdoor, you can use hard sunglasses or blinds to, reduce the amount of lighting. You can also adjust your screen brightness and contrast. My phone sometimes, when I'm using it, if it's too close to my eyes, it will indicate that it's so close. I need to take it out. Yes. So you can also activate such features on your phone as well, because, they're artificial light. No matter how you classify them, at some point when you are repeatedly exposed to them, some form of damage may occur, which you may not know about. Okay, and well, we have some optical solutions.
Before I allow you move on to the optical solution, how then do you describe a situation whereby someone is walking from, because you mentioned now that we can actually expose your eyes to natural light. You're coming from the sun outside, and then you walk into a building, and then your vision gets blurry. Or dark, yes. And then it will take about they say about a minute or two.
Seconds. It should be seconds, not minutes.
Okay, seconds, right?
Adaptation.
Okay.
Every human being experiences that.
Really?
But the rate at which you respond, if it's longer than necessary, that's what the problem is. Now we have rods and cones in the eye that controls, the amount of lighting and help us to regulate light, and then we have the pupil also that dilates and contrasts to help us with that. So whenever you come in, when you are in a very well lit environment, your pupil will constrict.
Okay.
On its own, it tries to reduce the amount of light such that your eyes are not overwhelmed and you are still able to see. And then when you are in a dim illumination, your pupil will also try to dilate or relax, so that more light. We see by light actually.
Yes, sure.
But the amount of light that goes in and out of the it goes into the eye to a large extent will determine how well you are going to see, or how those rays of light enter the eye. If they are straight, crooked, or wavy, it's going to determine the quality of image that you are seeing. So for someone who comes in from a very sunny environment, because your pupils while you were in the sun were constricted, and you come in immediately to a lesser lit or a dimly lit room, it's going to take its time for the pupil, to go back to normal. So for every human being, every individual, it's in seconds. But when there is a problem, when it's now taking longer, it's taking you longer. Sometimes it comes with dizziness. Some people have to
I used to experience that, but I can't remember the last time I experienced that ever since I started using my glasses.
So we advise that you use your glasses to avoid stories that touch.
But I'm better.
It's just like when you're driving and then oncoming rays, enter the eye. There is a level of adaptation that every driver is supposed to have. But when it is beyond that threshold, then there could be a problem. It means the brain and the eye, the communication somehow is being affected by some factors. So you may have to have your eyes tested to find out if it's a more serious problem or it's just aging actually can reduce it, refractive errors, some underlying eye conditions as well.
Okay.
So that's why it's important to have the eyes tested. How do we prevent photophobia? You just use your protective eyewear in bright or hazardous environment. Manage your screen time using the 20-20-20 rule. That means if you are heavy computer users, you use computer every day, do the 20-20-20 rule. That means for every 20 minutes that you are looking at your screen, take time to look at something 20 feet away for 20 seconds. Make a conscious effort. Before you know it, you start doing it unconsciously. Just like after learning how to drive, you drive unconsciously. Same thing. So you are working on maybe your desktop now. Make a conscious effort to look straight ahead after about 20 minutes for about 20 seconds. So that's another way of, reducing strain on the eye while you are working on your system. And keep the eyes lubricated by blinking. Make a conscious effort to blink. While you are just working, just try blink, and
you look
blink regularly. And then if the underlying eye conditions, you have to treat it like refractive error. You have to treat it and wear your glasses as well. Avoid self-medications too. Avoid self-medications with eye drop and anything that will just complicate your eyes. And then, lastly, there are some occupations that are really, really
hazardous.
Affected, by photophobia. Bankers and office workers, screen users, like you now, you're always on the screen.
I am glued to the screen.
Yeah, drivers too are always affected. Outdoor workers, sunlight exposure, especially the heat of the sun. From that 12 till about 2, 3, when it's
4
really
sometimes.
Hot, sometimes 4. Especially here, the weather can be really, really hot.
Yes.
Photographers, designers, IT professionals, intense light,
printers.
Exposure. Yes, exactly. Even health workers, especially all those in radiological areas.
Yes, absolutely.
So they are also exposed. Students too, prolonged reading and digital use. Most schools now, they use digital devices. To teach. So one just have to be careful. There are a lot of public health significance. So, number one is that it's been underdiagnosed and misattributed to other causes. Like I said, malaria is a major culprit. And then it can affect productivity, mental health, and even the quality of life. We need awareness campaign, especially in high screen use populations. Early intervention can prevent complication, and that's why I did a study in Nigeria looking at the effect of screen time on young people from 18 to 40 years. Yes. And I discovered that an average Nigerian within that age bracket spends over 6 hours every day. That's what my study revealed. And then for those who spend more than 2 hours every day on a digital display, especially phone, they have some form of, eye problem or eye symptom. So my OSDI score, the Ocular Surface Disease Index score, actually, pinpointed that these people could be at risk of, the computer vision syndrome or dry eye disease as they continue to use.
Let's begin to take this home.
So let's be careful. I'm putting out a book on that very soon, so that people can read and know what to do to protect their eyes.
All right, then, you've heard it from Dr. Imade. Of course, she comes in every Thursday. I have loads of questions I really need to ask her, on this particular topic. But then, she will be back next week. Subsequently, we'll be asking all of these questions. Should you have any question whatsoever, you can also reach out. We all know how important having a good eyesight is, so please always go for that eye checkup regularly. Most importantly, if you notice any sign of discomfort, do not hesitate to check what is wrong. Hence, our reason for painstakingly bringing you this show every Thursday to educate ourselves. Always remember to stay safe and healthy. If you missed any part of today's show or previous editions, you can always catch up on our Facebook page and YouTube channel at Lagos Traffic Radio 96.1 FM. Search with the keywords Eyes on the Road. Dr. Priscilla Imade, OD, MSc, PhD in Public Health, is a consultant optometrist at Modern Eye Foundation and a fellow of both the American Academy of Optometry and the Nigerian Optometrist Association. For inquiries, please visit plot 1618 Ogunosi Road, opposite Amole Estate, Phase 1 by Akiode, Pastor Ojodu, Berger, or call 0803-333-6672. On behalf of the production team led by Micah Rocha with assistance from Bakri Kausara, our executive producer is Taya Akonli. My name is Tayo Barua. I must say a very big thank you to you, Dr. Imade, for coming on the program this evening. Eyes on the road, your safety, our priority. Lagos Traffic Radio, 96.1 FM. See you next week.